Welcome, and thank you for joining us for this ASPPH Presents webinar. My name is Jonathan Sung, Manager of Educational Initiatives for ASPPH. This session is being recorded and will be available on the ASPPH website shortly after the conclusion of today's webinar. Please note that attendees may receive continuing education credits for Certified in Public Health, Certified Health Education Specialist, and Master Certified Health Education Specialist. More details will be presented at the end of this webinar. You can ask questions or submit comments in writing at any time during the presentations by clicking on the Q&A button at the bottom of your screen. We will hold questions until all of the presentations are finished. Here are the learning objectives for today's webinar. By the end of today's webinar, participants will be able to describe strategies for introducing and connecting community college students with four-year colleges and universities, describe strategies to help students transferring from community colleges succeed in four-year colleges and universities, and describe strategies to recruit, retain, and support students of all backgrounds, especially students of color, LGBTQIA+ students, and students living in poverty to succeed in their educational pathways in public health. Your moderator for today's session is Dr. Laura Magana, President and CEO of ASPPH. Please join me in welcoming Dr. Magana.
Thank you, Jonathan. Welcome. Good afternoon or morning, depending on where you are. I'm honored to have the opportunity to moderate this webinar, Pathways to Public Health for Community College Students, co-hosted by the Association of Schools and Programs of Public Health with our very important partners, the League for Innovation in the Community College and the Society for Public Health Education. ASPPH began to work with the League and SOPHI in 2012 on an important initiative focused on the community colleges and public health project as part of the ASPPH Task Force on Framing the Future, the second 100 years of education for public health. In 2014, the report recommended that community colleges consider offering public health associate degrees that would prepare graduates to transfer to an accredited four-year institution and or enter the workforce. We need to create a more efficient transfer system and build stronger strategic partnerships between community colleges and four-year institutions. A recent study by Insight Higher Education and Hanover Research, published in October 2020, indicates that there are promising approaches being developed to attract, support, and graduate transfer students. During today's webinar, we will be hearing from leaders in the field who will be discussing strategies to improve student transfer from community colleges to four-year colleges and universities, and strategies to attract, retain, and support students of all backgrounds, especially students of color, LGBTQIA+ students, and students living in poverty to succeed in their educational pathways in public health. It is now my great honor to introduce our presenters for today's webinar. Dr. Richard Riegelman is founding dean and professor of epidemiology at the George Washington University Milken Institute School of Public Health and the recipient of the ASPPH Welch Rose Award in recognition of his distinguished service to academic public health. Dr. Cynthia Wilson is Vice President for Learning and Chief Impact Officer at the League for Innovation in the Community College. Dr. Andrea Salis is co-director of the Public Health Associate's Degree Program and Associate Professor of Health Education and Queensport Community College of the City University of New York. Dr. Anuradha Srivastava is co-director of the Public Health Associate's Degree Program and Assistant Professor of Biological Science and Geology of Queensboro Community College of the City University of New York. And Dr. Ayman El-Mohandes is Dean of the City University of New York Graduate School of Public Health and Health Policy and Chair-elect of ASPPH. So thank you all for joining us today. Please join me in welcoming Dr. Richard Riegelman.
Thank you very much, Laura. Laura has given you a sense of the importance of the Community College and Public Health Report, and I'd like to spend my time trying to give you an idea of what that report did, what it laid the groundwork for, and how it might evolve as we move into the next cycle of growth and development in public health. The Framing the Future project was a very important effort to not only celebrate the first 100 years of public health education, but look ahead to the next 100 years, and even more relevant to the next decade of public health education. And as part of that, one of the key components of this project, one of the strategies underlying the Framing the Future, was the concept of a continuum of public health education. And that, in some ways, was a new concept, particularly new in the sense that community college, for the first time, were recognized as an inherent part of public health, as an inherent organization that needed to be fully engaged and needed to be fully appreciated, to understand the ability to appreciate community colleges and to take advantages of all of the many assets of community colleges. So next slide. As a result of the efforts, we put together with the ASPPH and the League for Innovation in the community colleges taking the lead, put together a important report on community colleges and public health. And this report was widely circulated by both ASPPH and by the League to community colleges. And it's laid the groundwork for what's been accomplished in the last 4 years and for what I hope will be accomplished in the coming years. Next. Built into the strategy for community colleges and public health was the effort to engage a whole spectrum of public health organizations, so that the specialty organizations in public health, Society for Public Health Education, and as well as the health administration and environmental groups that provide specialty education at the undergraduate level, were part of this. And the practice groups, which very much are part of it, because as the commitment of the community colleges clearly is to careers and to jobs. And so that we wanted to be sure that the public health jobs were open and available. So we had the Association of State and Territorial Health Officers, ASTO, the National Association of Community and City Health Officers, NACHO, and also there was involvement of AAC&U. So the full spectrum of organizations educationally and professionally, because the goal here was to create careers, to create pathways, to create opportunities for community college students as part of the continuum of public health education. Next. So what did the report do? Well, first of all, it established, and I think it still has very much an important part of indicating that community colleges must be an inherent part of the continuum of public health education. Now, how do we operationalize that? Well, the report indicated that there should be associate degrees developed in community colleges, and they should be both generalist degrees as well as specialty degrees in health education, in environmental health, and in health administration that can be transferred to bachelor's degree programs. In addition, we recognize the importance of direct access to the job market, and an important component of this was the concept of community health worker, or also called health navigator, which provided the possibilities of going directly into the job market with an associate degree. So this, the whole idea of creating career development through both transfer associate degrees and ones that go directly into the job market were key to that. But it was also recognized that we needed to facilitate the transfer of students from the community colleges to four-year colleges, and to do that, we needed to have more than just formal articulation agreements, which, as I'm sure many of you know, are complex and arduous documents, and we needed a much more fluid strategy that allowed people to transfer credits. So we tried to outline three health foundation courses that we felt were critical to all, not only public health education, but health professions education at large. So we recommended for community colleges a course that's sometimes called Health and Wellness be modified to include a population perspective. So personal health with a population perspective. That there needed to be overview of public health courses. And there also needed to be health communications, both at the individual level and at the population level. And that these three courses were essential as health foundation courses and remain important in concept of how do we transfer, how do we help students transfer. In the last years, since the 5 years since the report was issued, some important changes have occurred. First of all, there have been associate degrees programs developed, a relatively small number still, but there are 15 or so programs around the country, and you're going to hear about some today, that do provide associate degrees at the community college level. And there's been a network developed that tries to tie together these programs, tries to increase communications, and tries to welcome new programs. And for anybody who's interested in developing new programs, please contact me and I will hardwire you to this group. I'm sure they'll more than welcome your participation, even if it's one of inquiring about the possibilities of developing programs. Secondly, there's been a move to really engage the community college students. And through the league, there's been efforts to support community college student groups, and several dozen have been supported for providing public health activities during National Public Health Week in the last 2 years. So the students are very much engaged. Third, the student is the faculty engagement. And I've been delighted with there were over 500 people registering for this webinar today, and a very large number attending this webinar. And I think that's great evidence of the success of this efforts. Finally, I think that in the last 5 years, there's been a important appreciation by the public health community of the central roles, the key roles that community colleges play. The community colleges are really a unique national resource, that they provide opportunities for students that are essential for students to move both economically and professionally. And it's truly a unique way for students to move ahead in society. A second unique features of community colleges is their diversity. The fact that they are majority minority, that they come from communities who are served by public health, but whose workforce is not necessarily representative of those communities. It's an enormous opportunity to diversify the public health workforce. And third, I think a greater appreciation today of just what community college faculty do. Their commitments to success, their commitments to completion, their commitments to their students and their futures is really impressive. And I've been most pleased to see to meet students, to see the possibilities in faculty, and through the work of the League for Innovation in the community colleges. So to understand more about what the League has done and is doing, I have the pleasure to turn over the microphone to Cynthia Wilson, Dr. Cynthia Wilson from the League for Innovation in the Community College.
Thank you so much, Dick, and thanks for that overview of the work that we've been doing with you for the past 8 years or so. You want to go to the next slide? I want to start by telling everyone a little bit about the League for Innovation in the Community College, and then move to some of the work that we've been doing in public health education since about 2012. The League was founded in 1968, so we've been around a while. We're a nonprofit membership organization. We have about 500 institutional members. And our mission, as the name suggests, is to cultivate innovation in community colleges. To that end, we serve as a catalyst for introducing and sustaining deep transformational innovation within and across colleges, always with the goal of increasing student success and institutional excellence. And we do this through programming, events, publications, projects, partnerships, those kinds of things. And what you can see on the slide or 4 of our broad focus areas. And just a few examples of some of the things that we do each year. We host an Executive Leadership Institute for aspiring presidents. We also have an innovations conference, and we hold learning summits. We're currently working on a project with 2 rural community colleges to develop innovative approaches for hunger relief for students and their families. And we're also involved in a partnership to improve the visibility of community college workforce programs for potential students and employers. And you can find out more about the League on our website there, www.league.org. And the next slide, specifically related to public health, Dick has just provided a lovely overview of the Community Colleges and Public Health Project, which we've been working on for the past 8 years in collaboration with ASPPH and SOFI. And we appreciate all of the support we get from both of those organizations. This slide lists a few of the items associated with our initiative in public health. Several of the resources are available, including the report that Dick was just talking about, are available at the URL on the slide, which is www.league.org/CCPH. I realize that some people have called in, so they can't see the slides. But I want to make special mention of the last bullet, COVID-19, the Ultimate Public Health Challenge. For the past couple of years, the League has offered small grants to faculty and student groups to hold events or activities that promote careers in public health. This year, the focus of the small grant program is on supporting community college faculty in the development of curriculum on COVID-19 as a public health issue. These small grants are intended to encourage and facilitate the integration of information about COVID-19 into the education of community college students. And community college faculty teaching in any discipline or course are eligible to apply. As we all know, COVID-19 is not restricted to impacting just the health industries. It's affected everything. So we see that there are opportunities to integrate COVID-19 curriculum into just pretty much any discipline. The deadline for submitting a proposal is January 31st, 2021. And again, you can find information at that same URL, www.league.org/CCPH. One of the ways that ASPPH has supported us is through their Student Ambassador Program. And on that same website, you'll find information about that and how you can, there are links to information about how to request one of the student ambassadors, maybe to be a guest speaker or perhaps to participate in some other activities, again, to promote public health education and careers. So again, information is there at that same link. Earlier in our community college and public health project, the League promoted and supported public health programs and courses in community colleges. There are, as Dick said, there are still just a few of those out there, but we have been involved in supporting and promoting those programs through a series of awards. And one of the early award-winning public health programs was at Queensborough Community College. So I'm especially delighted to introduce the program's co-directors, Dr. Andrea Salas and Dr. Anuradha Srivastava, who are our next presenters.
Thank you, Cynthia. Okay, we can go to the next slide. So I'm very pleased to present on public health degree programs for community college students. Dr. Srivastava and I are program directors of our AS Public Health at Queensborough Community College of the City University, New York. And our program initiated with the meeting of community college faculty and senior college faculty that was organized by our esteemed colleague, Dean El Mohandes, to meet to discuss opportunities in public health for associate degrees, as well as to create a pipeline for students from the associate degree level all the way to the graduate school level. And so we can go to the next slide. We currently have at the City University of New York 6 associate degree programs in public health. 4 of those programs were established after the community college and public health project and final report. And that project led by the ASPPH and the League for Innovation and the Society for Public Health was instrumental in our development of associate degree programs at the City University of New York. Queensborough Community College's AS Public Health began in the fall of 2016. It is co-sponsored by our Biological Sciences and Geology Department, together with our Health and Physical Education Dance Department. We currently have 49 students enrolled, and an additional 13 students graduated previously. Many of them have gone on to our four-year colleges at the City University of New York, namely York College and Hunter College. And you'll hear more about that later in our presentation. And so I will just also mention that at the City University of New York, in order to propose an AS, a transfer degree program, one needs to have established an articulation agreement, or that the students will be able to earn their two-year degree, and that those credits will transfer to the four-year degree. And so that really set us up for on our pathway to building and maintaining strong relationships with our four-year college, which is essential. And I also want to mention about Cynthia and the League's support for events and activities to promote public health at the community college. That was essential because many students did not know about public health degree programs, and having events and activities to foster interest and awareness of the opportunities was very critical at the time. And it also, so some of our events that we had included involved our four-year college partners, so that the students could meet the senior college faculty and learn about the four-year program while they're in the associate's degree program. We also had events that invited students, alum, to meet with our current students so that they can see the pathway, make it very clear to them that they're starting at the associate's degree, but they can continue on. And our associate's degree program provides the foundational knowledge for students to continue in their studies, as well as it provides skills for students to be able to develop their ability to go into the workforce if they choose to do so after earning an associate's degree. And so I think we can go to the next slide. And this slide just speaks of, demonstrates the various CUNY campus locations. CUNY has 25 campuses across the 5 boroughs. We have 11 senior colleges, 7 community colleges, and 7 professional and graduate school programs. And the 6 associate degree programs in public health are all diversified among the 4 of our boroughs. And we all work collaboratively with one another. It was really a supportive environment to work with each other and develop our degree programs. Okay, so we can now go to the next slide. One key factor about City University of New York, as well as Queensborough Community College and all of the CUNY campuses, is our diversity. Diversity is one of our greatest strengths, and we embrace diversity and instill a sense of belonging for all our students. At Queensborough, we have nearly 32% of our students are Hispanic, 25% as Asian or Pacific, and 22% as African American. That's a total of 80% of our student population at Queensborough Community College are a minority. And you see that the examples of other community college, Borough of Manhattan Community College and Bronx Community College, having very high levels of minority serving institutions. And this is a pride and also a place where students can be successful. At Queensborough in particular, our students come from 140 countries and speak 84 different languages. Many students are first-generation college students. And serving one of the most diverse student populations makes offering a public health degree even more meaningful and important. We strive to provide social mobility and opportunities for our students. A CUNY education in public health empowers students to improve the health and the lives of people across diverse communities. And so we can go to the next slide that we have here. Again, we speak about the Community Colleges and Public Health Project as providing the framework for our degree program. And we have been very blessed to have incorporate the knowledge of across the nation to create our program. And we can now go to the next slide. As we see here, that there are many curricular programs, courses that we include in our programs. And it has just been either we have them as individual courses or they're embedded within courses across our curriculum. But we do follow this model, and it works very well in terms of transfer to four-year college, and that was essential for us. I just want to also mention that we also have great student support at our campus in terms of strategies for helping students become successful at the two-year college and for preparation for the senior college, that they, our student support services, our advisements, our counseling center, our tutoring services, and many other services work to help our students succeed. And we work in a coordinated way so that we are meeting our needs of our students and allowing them to progress. And the next slide speaks also about the additional common curricula among our community colleges, so that we see this very general education type courses that our students take. This is the foundation that will serve them well when they continue on into their four-year college. And so now at this time, it is my honor to present Dr. Anuradha Srivastava, who will speak more about our program and characteristics of our program.
Thank you, Dr. Salas. So Dr. Salas just shared with you that framing the future curricular model is really embraced across all community college campuses in CUNY that are offering associate's degree in public health or community health. And it has played a significant role in guiding not only the curricular offerings, but also the program outcomes. And across all the colleges, you can see that we have all worked on aligning competencies with certain set of skills which correspond with workforce requirements. Now, besides that, Dr. Salas also shared about some additional course offerings. However, I would like to bring to your attention that these programs or these colleges are not competing against each other, because each college receives student population from a given area, and sometimes these students also select these programs based off their interests and where do they see themselves in the future in public health workforce. Now, most of these colleges, as you can see over here in this slide, that they have something special, and they emphasize and focus on certain characteristics that make them stand out from another college on a CUNY campus. And at the same time, every college has paid attention that these offerings are in alignment with senior colleges' requirements for entry into their baccalaureate program in public health or community health. And these courses are aligned with competencies-based skills required for accreditation, though at associate's level, these programs are not accredited, but we want to make sure that whatever we are offering aligns for these competencies that are required for accreditation. And they fit very well in the competency-based framework puzzle overall. So if you can see that different colleges are emphasizing on different kinds of courses. Here at Queensborough, I would like to get your attention at QCC, Queensborough Community College. Our program is really unique because it's a very good blend of biology courses and health education related courses, because we understand that if we want to prepare these students and give them a solid foundation to be successful later on as they move on to senior colleges or they join workforce, they need to have a good understanding of the biology and education aspect of public health. Next slide, please. So this slide basically shows you a little bit more in detail about our course offerings. Besides all the courses that were shared by Dr. Salas in the beginning that follow the curricular model, we offer a variety of electives. And if you see on the left side are mostly the courses related to biology, and on the right column are the courses related to health education. Now, based on student interest, they can select whatever electives that where they think in the future they want to pursue on their path to public health as a public health professional. For those students who would be more, just like as, especially in the time of COVID, as we know that there are a lot of efforts ongoing by CDC, for vaccine development or drug discovery. So those students who would be more interested in that kind of pathway, they can select these electives from the biology column. And those who would be like to get engaged more in the health education aspect of public health, they can select electives from the right column, or sometimes even if they are not very sure at this point what they would like to pursue in the future, they can take a blend of each and figure out that how would they like to proceed in the future. Thank you. Can you give me this next slide, please? So besides this, so as Dr. Salas, Dr. Riegelman, and Cynthia also mentioned, that articulation agreements are very important for creating a smooth and seamless transfer of these students after earning their associate's degree in public health to a senior college where they can continue their education if they would like to in public health or community health programs. So all the colleges of CUNY that offer these associate's degree program have an articulation agreement with a variety of senior colleges within CUNY and outside of the CUNY campus as well. And as you can see that Queensborough Community College over here has an articulation agreement with public health BS Public Health program at Hunter College. We have an articulation agreement with BS Public Health Education at York College. Currently, we are pursuing and we are in the final stages of finalizing our articulation agreement with BS Community Health Education program at York College. And you can see here that Queensborough Community College even has an articulation agreement with a college which is outside of the CUNY campus. And this is something that Queensborough is also looking at. If there are any colleges and universities that offer degree programs in public health at senior level, we are very much interested in that so that our students have more options. Now, the beauty of articulation agreements is that all those 60 credits that are earned while earning the associate's degree, these are seamlessly transferred and accepted towards baccalaureate degree programs in these senior colleges. So that, students, whether they want to continue, they don't have an issue about their credits being transferred. Next slide, please. Now, besides these articulation agreements, we really would like to talk about very valuable program partnerships of these colleges within their campuses and outside of their campuses. And most of these colleges, they work very closely with their continuing education and workforce development offices on their campuses. And Queensborough actively is engaged with continuing ed and workforce development office here at our campus. And I would really like to bring your attention to this Certified Recovery Peer Advocate program, which is offered at QCC. This program trains those who have experienced substance use and recovery So these students are trained to work as behavioral health peers, guiding others through the recovery process. So this program prepares the students to meet the eligibility requirements for SERPA certification and to take the certifying exam and also work as SERPA professionals. They gain connections with employees and they earn 3 college credits towards QCC public health program. We have also developed relationships with New York City Department of Health and Mental Hygiene. And we are currently working for connecting our students for internships over there. Now, the last part is we are really focusing, and this area is very important right now, is developing opportunities for micro-credentialing. So we all know that micro-credentials is a new way to experience college. Students can get a credential in a skill they need, and then another and another, and these can quickly pay off on its own by helping to get a job, or they can add up over time to an academic degree. So this really motivates the students to persist as an add-on to an existing academic program. And if they wish, it also allows them to apply for a job and allows them to distinguish themselves in a competitive marketplace. So currently we are looking into developing two such micro-credentials. One is contact tracing, very relevant in today's time, and we know this is not the last time. To prepare for the future, we really need trained contact tracers. And the other area that we are looking at is food safety inspector certification. So these are some of the things that we are working on. And I really believe that at QCC, our program has really evolved, keeping up with the evolving needs of public health workforce. And with this, I think I've given you a good overview. I would like to thank all our colleagues at different community colleges over at CUNY that helped us present this data to you, and we always partner with them. And with that, it is my honor now to introduce and invite Dr. Ayman El-Mohandes. Thank you.
Hi there. Good afternoon and good morning to you all. It's a great pleasure to be part of this panel, and just a brief introduction of City University of New York, since some of you may not be familiar with this university, but is one of the prides of New York City. Currently, City University of New York has approximately 275,000 students and 265,000 continuous learners. In its entirety, the student population at City University of New York exceeds 500,000 students in one city. A recent publication by Harvard University showed that City University of New York moves more people from the second lowest quintile of poverty to the second highest quintile of wealth. City University of New York does more of that than all the Ivy League schools put together, plus Stanford, plus the University of Chicago, plus MIT. So we see ourselves as a workforce engine for New York City, since the vast majority of our students do stay in the city, but also an agent for social transformation. 60% of the students at City University don't pay tuition, and 80% graduate without debt. Having said that, focusing on the topic of today, it is really interesting that some of the important elements of who we are as a university translates into our success in attracting students at the associate degree level to one of our 6 programs strategically placed geographically across the different boroughs of New York City. We, as has been described, attract a very diverse body of students, with close to 70% of our students coming from diverse backgrounds, being themselves immigrants or children of immigrants, with multiple languages and multiple cultural backgrounds, and a remarkable degree of resilience and community knowledge I usually say that our students come to our programs already pre-qualified with a life experience that assists them in their careers, especially in public health. I am also going to emphasize the fact that the university, with the many community colleges and the senior colleges, has an opportunity of easy articulation and clear pathways for transfer, since we share at the different levels, both at the community and the senior colleges, a common platform we call Pathways, which really unifies our approach to basic education. And as such, many of these courses are easily transferable. Having said that, we are very in the process of creating new ground and new successes, since 4 of the 6 existing programs within the university are relatively new. We are proud that the program in Kingsborough Community College actually was the first in the country, but 4 of our 6 programs have evolved more recently. And despite the fact that they are geographically distributed in various areas, they also have unique characteristics. Some of you have asked on the question answer panel whether the associate degree itself is conducive to a professional career, or whether the only purpose is for these students to move into a senior college to get a bachelor's degree. And the answer is absolutely yes. But in order to do that, Dr. Riegelman did mention that some of these programs are generalist programs, and these generalist programs are better suited for a pathway to a bachelor's and eventually a master's in public health. But some of the programs are more specific, leading to a set of skills and competencies that serve careers as a community health worker, a health educator. Some of them really focus more on gerontology and the elderly, some more in the area of informatics and quantitative sciences, some more in nutrition and food safety, as my colleagues have just pointed out. And these careers are growing in the city, and with a transfer of responsibilities across the wide workforce in public health, we are seeing that more and more are available to fill in career vacancies that are required. I don't want to be just painting a rosy picture, because that would be unrealistic. There is no question that during the COVID epidemic, we are seeing a drop in the number of applicants to community colleges. Students are struggling with challenges related to distance learning technologies, either because of the lack of availability of the bandwidth required to be able to follow these programs at home, or in fact, even the availability of the appropriate computers. City University of New York did distribute about 50,000 computers, laptops, to its students in order for them to transfer from in the classroom to online education. And even with that, some of them continue to struggle. On the other hand, the COVID pandemic has offered us new opportunities of enhanced job opportunities for our graduates. Most significantly, as my colleagues have mentioned, Anuradha and Andrea both have mentioned the whole army of tracers and trackers in New York City, and some of our graduates are able to compete successfully for these jobs. Amongst those of you on the question answer panel have asked, what is the difference between public health and allied health? And I see allied health to be more directly engaging clinical careers, but public health does not necessarily do so. One of you asked whether they can be terminal degrees, meaning the student really just looking for the associate degree as their final milestone, and the answer is yes, as I have just pointed out. Some of you asked about the relationship between nursing careers and some of the associate degrees in public health. And I would say that many of our community colleges do offer courses specific to nursing programs and articulated with bachelor's level programs for nursing. And unlikely that the students who are wanting to pursue that career are choosing public health, but some of them are. Finally, as far as MPH is concerned, one of you asked whether people with various areas of preparation and bachelor's of arts and science would be acceptable to the MPH level of training. And the answer is yes, due to the very wide diversity of MPH training, either in quantitative science, epidemiology, biostatistics, behavioral sciences, and community health sciences, as well as policy, environmental health, and occupational health. These are all domains that require different kinds of preparation and different kinds of degrees. So we accept people who are thinking of pursuing even clinical degrees in the future, applying to medical schools or to nursing schools. And some of the schools also offer joint degrees with schools of law. So the diversity of the career encourages students from a very wide background to participate in these programs. We, as City University of New York, are very, very proud with the strides that we have made in creating a continuum at the associate degree level, the bachelor's degree level, the MPH and MS degree level, as well as the PhD level. So we have the full continuum of public health education within one university that is really a seamless and much, much easier course to follow for these students. Nonetheless, some of the students may choose to continue their careers elsewhere for a variety of reasons, and we certainly don't hold our students hostage. With that, I come to the end of my presentation, which was meant to be a very general presentation on our situation on the topic. And I'm very, very proud and really delighted to introduce back to you my dear friend, Dr. Laura Magana, who I think will bring this session to a close. Thank you for listening.
Thank you. Thank you all. Has been really great presentations, very informative. So we just have some minutes in order to answer some of the questions. Thank you very much for the answers that some of our panelists have already answered some of the questions. And I also want to remind everyone that we're going to send all the emails of our presenters. You can follow up with them with the specific questions. But I would like to take a couple of them that are already in the Q&A, and we have a lot. But let me start with the first one that Kathy is asking us. So adult basic education focuses on integrated education training models where we move students from basic education into the healthcare field. Are you or any participants familiar with these IET models? I'm not sure how many adult education professionals are in attendance. So anyone can answer that question?
Well, we certainly have a large audience at City University of New York that come back to the University for Adult Education and Career Advancement. We offer across the board, both at the community college, but also at the senior colleges, a lot of training with formal and informal certificates, formal meaning for credit and informal meaning non for credit, but skills building certificates. And you know, that is something that is very valuable, but we also encourage many of our adults, learners in New York City who have spent part of their life in higher education, but were never able to attain the milestone of graduating, either with an associate degree or with a bachelor's degree, that we have a very strong system of advisement that attracts these students to come back to the environment of higher education and complete their degrees as well.
Thank you, Doctor. Mohammed, there's another question that says, would a student be able to work on a master's degree in public health if they have a BS in another field? The other field is human services.
Yeah, I believe I answered that question, and the answer is yes.
Mhm. Okay. How about how have you handled the specialty internships since COVID and pivoting to online instruction?
Are you talking at the master's level then?
Not necessarily there. It's open.
Yeah, I think my colleagues
Yeah.
from Queensborough might have ideas about internships and practicums that their students can participate in.
So unfortunately, that is true that, you know, this pandemic has affected all aspects of life, and including any kind of engagement in field work or internships. But a lot is coming up now that we are slowly trying to open up. We recently had a seminar through New York City Department of Health and Mental Hygiene, and a lot of internship opportunities were shared with our students. And we are now encouraging our students to apply for those internships, because the fact is this, that New York was really on a pause. New York City was on a pause, and safety was a big consideration. So, but you know, New York City never stops. So we are getting back to our, you know, the new normal. But yes, we are going to start slowly once again. Thank you.
Thank you. Let's take another one. Thank you for the presentation. I would like to hear more about your process for the contact tracing micro-credentialing.
Okay, so I think there was another question that do we have partnerships for micro-credentials? How do we think we will be doing this? So as I mentioned, that we are working closely with our Continuing Education and Workforce Development Office, and they are supporting our efforts. New York Department of Health offers a food inspector certification, and also we're working with Johns Hopkins. So we are exploring all our possibilities, where we can partner, where we can learn, and then we can offer it through our Continuing Education and Workforce Development Office, and that can be then also added to our program curriculum. And Dr. Salas can tell you a little bit more about SERPA, which is already in place and that we are running very successfully at Queensborough.
Thank you. So, Dr. Riegelman, the incoming First Lady, Dr. Jill Biden, has announced her plans to continue teaching at a community college. How do you see her plans helping to bring greater attention to community colleges and perhaps this important sector of students?
I think this is a fantastic opportunity. Jill Biden's commitment to community colleges has a national influence that is rarely felt. And I think that she can bring the attention to community colleges that it so desperately needs in terms of understanding community colleges. And certainly the resources. Community colleges have really not had the financial support they need, and I hope that there will be much more focus as a result of this. And finally, I think she certainly appreciates the opportunities that community colleges provide in terms of careers, in terms of jobs. And for public health, I think that means that we need to take advantage of the fact that the community colleges are now majority minority. And that's a unique situation. It really represents the opportunity to diversify our public health workforce in a way that allows the public health workforce to reflect the communities they serve. So this is a wonderful opportunity, and by someone who really knows and appreciates community colleges. And I hope it will make a big difference.
Thank you. So Dr. Wilson, are you seeing an increase in interest in public health as a result of the pandemic?
I think, I guess I have to start off by saying first, the registration number for this webinar is promising. It certainly, I think, reflects some interest. And we've done webinars in the past that haven't been quite as as large as this one has become. But I think also in what I can say is in the small grants that we give each year. Last year, the grants, they were to promote careers in public health, and initially were designed to occur during National Public Health Week, which is early April. So of course, April came and no one was thinking about that. People were the colleges were very much engaged in moving everything online and trying to deal with the pandemic and with their students. But so we extended it, of course, and we said, move your program online and, move it into the fall or summer or, whenever you can get it done. But what we're now seeing, the colleges are beginning to turn their reports in, and it's very promising. They're talking about how they've conducted their activities online, and the number of prospects that they've received for people who are interested in coming into their programs and looking for more information has increased. So, that's very anecdotal, but that's the kind of thing that we're hearing. So I think we have, it would certainly make sense that something like this, an event like this, a situation like COVID-19 would pique people's interest in these kinds of careers. So we're hearing a little bit more about it.
Thank you. Last question, Dr. Salis, and very quick answer. As many students attending community colleges work while attending college, can you talk about some of the challenges, maybe just one challenge, that these students face, especially in terms of supporting them in transferring to a four-year college?
Yes, so as Dean Almondes had mentioned, there are challenges, and certainly our community college students are challenged with a lot of responsibility and issues that arise that can impact their studies. So one challenge is students completing their degree program in a timely manner. So students may take 3 or more years to graduate, and that the college and the City University New York really strives to help students build momentum to enroll in 30 credits over the course of a year, to participate in STEM waiver program where they can have free tuition for winter classes and summer classes so that they can continue with what they started. But I definitely see a challenge being when students do not complete their program requirements in a timely manner.
Well, thank you so much. This has been really a terrific conversation. So first of all, we encourage all of you to share the link. This is a recorded session, so you can share the link. Please also be aware that there is a link also for evaluation. Your evaluation, your feedback is very important for us, so please make sure to send us your feedback. So thank you very much. This ends our webinar. Thank you for all the attendees. It was incredible the number of people that we had and really the engagement in terms of the conversations in the Q&A. Please forward all your questions specifically to the presenter that you were asking that question. It was impossible to actually reach all the questions. It was just too much, but it has been, this is a great beginning. So thank you so much and have a great afternoon or a great morning for the ones who are on the other side of our nation or of the world. And thank you so much for being with us. Thank you all the time.